For example, at the start of the outbreak, the advice was for only people who are unwell to wear a mask. Now there is a $300 fine for anyone going around without a mask. Why the change? Prof. Teo, would you like to lead off?
So let us take a look at the policies around masks. In January and February, there was a very strong message to the public that you should not be wearing masks unnecessarily unless you are not feeling well. And that message there seemed to be this U-turn by the government with regards to its policy around masks. So a couple of weeks ago, the country changed its stance around masks, and now there is a very strong messaging that mask is required. So these are some of the timeline of events. And I really want to make 3 points. The first point is that our knowledge about the transmission of the SARS-CoV-2 virus, which is the coronavirus that we're dealing with, it has changed since the end of January up to this point. Because back in January and February, the knowledge that we have at that time is that it is unlikely to be asymptomatic. So that was what we understand. I think a point that we need to emphasize is that our knowledge about the coronavirus is changing all the time. And as countries start to learn more, our policies need to change accordingly. Secondly, Singapore right now is fundamentally at a different phase of the outbreak right now compared to when we were in end January and early February. The third point is that there is a need to protect national stocks and international stocks of personal protective equipment for the healthcare workers. That is one of the fundamental objectives that hasn't changed throughout. One point I would like to make is that if masks were really so important in preventing transmission and infection, we would have seen the situation in Singapore got a lot worse in February. Based on the situation right now, it is prudent, it is necessary to protect ourselves with masks. But really, if masks had such a big impact, we would have seen the situation in Singapore got a lot worse in February.
So essentially you are saying that masks are not that important and yet it's still important for us to wear them. That seems to be a little bit of confusion there. Perhaps, Prof. Leo, maybe you could talk about whether you think it's necessary and to wear a mask today?
Well, I think first of all, I would like to agree with Yi Ying that indeed the knowledge has increased. We learned a little bit more about SARS-CoV-2 that caused the COVID-19. And I think it is also very important to bring in these notions that our preventive measure needs to be flexible to the knowledge that we gain along the way. Now, I also want to emphasize that at this point in time, there are many studies in the past looking at influenza viruses and looking at other respiratory viruses. There always have been these debates about the usefulness of masks. But don't forget that having a mask on carries a very different behavioral connotations and meanings as well, that it constantly reminds us that we are in a very unusual period of time. And I hope that that kind of notions will also help us to be able to fully understand the importance in terms of social responsibility. In addition to masks, I certainly hope that in terms of the society, we can beef up our social responsibility in terms of cough and sneeze etiquettes. And even in a normal time, if we do have developed of respiratory symptoms, it's always good to put on a mask. I think it is for personal protection as well as protecting the society. And it's exactly what we need from the entire society and community today to be together to fight COVID-19.
So essentially you're saying that it's not just the protection the mask gives us against the virus, but also the fact that wearing a mask makes us behave differently socially because it makes us aware that there is an infection out there. So it serves two different purposes.
Right. I still want to add on that mask is not one and the only thing in terms of preventing the spread of the virus. Do remember there are many other steps that we emphasized before, and remember to keep them not just during the COVID-19 period, but it should be part of our daily routine.